Anemia is the second most common form of anemia in the world and remains one of the most important and severe nutritional deficiencies in the world. Developing countries in particular are the most heavily impacted by nutritional anemia. In fact, in sub-Saharan Africa, an estimated 50 to 70% of pregnant women are anemic, with 5 to 15% of those women being severely anemic. Today, we will be talking about nutritional anemia, what it is, how to treat it, and most importantly, how to prevent it. Next slide. So this is an overview of our presentation. We will first start with the introduction, then go to an overview of both the disease and setting, the social determinants, considerations, current strategies, our proposed intervention, implementation, and funding, reflection, and we will finish with our sources. Next slide. This is the team that has worked on this presentation. My name is Jake Edgem, and I worked with Sidiana Belena, Maya Anglin, and Ashley Mendoza to bring you this presentation today. Next slide.
As of 2019, 68.9% of children in Nigeria were diagnosed with or suffered from the effects of nutritional anemia. This, according to the World Health Organization, makes this a very severe public health case. By definition, anemia is a condition in which the red blood cells, or the hemoglobin within those cells, are lower than the sufficient amount. This obstructs the body from being able to get oxygen to tissues and organs. Just for further information, the amount of hemoglobin or blood cells that would be considered the normal amount depends on gender, age, smoking habits, elevation, and increased stress induced by pregnancy.
Bauchi, Nigeria continues to have high cases of nutritional anemia, with just over 70% of Bauchi residents under the age of 5 suffering from anemia. While the government continues to work on programs that promote a balanced diet, these programs and policies are working out of outdated data. This prevents the spread of more awareness, thus causing more malnourishment, especially among children.
Signs and symptoms are an important part of the diagnosis for nutritional anemia. The general symptoms include weakness, shortness of breath, leg swelling, pale skin, yellow eyes, low blood pressure, fatigue, and dizziness. However, our team was more concerned by the long-term effects that nutritional anemia will have on people. These effects will include stunted development or trouble in growth. Testing and treatment. The most common form of testing for nutritional anemia would be taking a full blood count. Depending on the effects of this account, this is how you would find out how you would treat. So with the testing, if it's less than 7 grams per deciliter, that is a severe case and it would require an immediate blood transfusion. For moderate cases, that's 7 to 9 grams per deciliter, and that would require parenteral iron therapy, in which the patient would receive iron supplements from an injection into the vein. And for mild cases between 9 to 11 grams per deciliter, that would include oral iron therapy, in which you would just change the diet of the patient to include more fish, leafy greens, and meat.
Our intervention aims to be considerate of both the cultural and bioethical obstacles in Bauchi, Nigeria. Most Nigerians' diet consists of plant-based foods accompanied by stew. They are squeezed and blanched, which significantly lowers their iron content. And since Bauchi is the 8th poorest state in the country, most of these people do not have access to iron-rich foods because of its high cost and lack of availability. Although there's no vaccine yet, the Sabin Vaccine Institute developed a vaccine to treat iron deficiency anemia for maternal and child health. While this can greatly decrease the disease, cost and availability still need to be taken into consideration. Various organizations from around the globe are engaged in efforts to treat and prevent nutritional anemia in Nigeria. One of these efforts, done by the CDC, included providing accurate and up-to-date data regarding malnutrition in women and children. Another initiative was sponsored by UNICEF, where they have support groups for breastfeeding mothers, teaching them proper nourishment practices and the importance of breastfeeding.
Our proposed intervention aims to help reduce the rate of nutritional anemia in pregnant women and young children. For this reason, our intervention will consist of a community workshop and the printing of flyers. Our community workshop will have three main topics addressed: how to prevent nutritional anemia in pregnant women, encouraging exclusive breastfeeding practices for the first 6 months of life, and teaching on proper nutrition and balanced diets. Pregnant women's bodies are under increased stress due to providing for two at the time. They require extra nutrients like iron, folic acid, and vitamin C. For that reason, it is important that they are supported with a proper diet and even supplements if necessary. So in our workshop, we will address the importance and make sure that everyone is aware of that. As well, once the baby is born, exclusive breastfeeding, according to the WHO, can significantly help reduce the rate of nutritional anemia. However, only about 17% of babies in Nigeria are being exclusively breastfed for the first 6 months. It is important that we acknowledge that fact that not everyone is able to exclusively breastfeed for 6 months due to inability to produce enough milk or cultural values. However, breast milk does contain enough hydration and nutrients for the baby to support itself. As well, for those who are slightly older or unable to breastfeed, that's where the nutrition education would come in. In order to have a proper diet, it must consist of plenty of nutrients. And a good way of doing that is by fortifying food, using available options such as spinach, egg yolks, and beans. Our infographic flyer consists of many strategies to prevent nutritional anemia, including fortifying meals, recommendations to see a physician if you feel any symptoms. It encourages exclusive breastfeeding and encourages supplements be taken.
Okay. So in order to assess the effectiveness of our intervention, we want to test the attendees of the workshop about nutritional anemia before they attend, and we also want to test them about nutritional anemia after they attend. This will help us gauge the effectiveness of our intervention as we can see how much the attendees have learned. As well as testing, we want to also follow up with the attendees twice, once 3 months after the workshop, and the second time 6 months after the workshop. This will help us further see the effectiveness of our workshop, as we can kind of see how the workshop has affected the attendees' lifestyle, and we want to see lifestyle changes in order to help them prevent further cases of nutritional anemia. So for the funding, we've located the bulk of our $40 budget, 50% or $20 to the workshop, which will include food and beverages. We have also allocated 25% of the budget, another $10 to 30 flyers, which will be given to workshop attendees for them to take home so that they can reference and remind themselves about what they learned during the workshop. And then we've allocated the remaining 25% of our budget, another $10 to 30 flyers, which will be hung up in the community before the workshop. We will hang 15 of them up in the marketplace. We will hang up another 15 of them up at schools and just places where there are a lot of people, so that we can get as many eyes on our flyers as possible. As for the timeline, this is kind of the timeline we want to follow for our intervention. We want to train LI staff in July and August leading up to the workshop. We also want the flyers hung up in the community during those same months before the workshop, and then the workshop will take place in September, followed by a 3-month follow-up after the workshop in order to assess the effectiveness of it, as well as another 6-month follow-up.
The target audience for our solution are pregnant women as well as the youth, because they and young children are at risk of nutritional anemia. Although this is true, our flyers will be targeting the whole community to educate them about the risk and prevention. Our main goal is to lower the rate of anemia in the youth and spread awareness about the prevention of nutritional anemia.
During this project, our team has worked exceptionally hard to create an efficient, effective, and educational campaign to work with women in Nigeria and further our teaching about the importance of breastfeeding. We acknowledged our limitations in time, funding, and research, recognizing that we were only given so much time to make the best campaign possible. We also recognize that as American high school students, we will never understand the hardships and difficulties of the women that we are working with in the community. And lastly, we put our best effort forward to educate ourselves about the ethical limitations so that everyone felt that they got the best from this presentation. These are our sources. Thank you so much for listening to our presentation.
First. Yeah, I don't mind. Well done, guys. You know, giving these feedbacks makes me feel like I'm talking to matured adults because of how thoughtful, you know, and insightful your presentation was, especially the reflection aspect. None of the other groups paid this much attention to their limitations. Of course, they tried hard, but I'd love to see outside of the box thinking. Okay, so the fact that you're aware of your limitations, you're aware of, you know, the ethical, and it was extremely thoughtful. Okay, I liked how you guys were going to do the before and after questionnaires to see how much impacts you have achieved in those people in their lives. That's a very good monitoring and evaluation scale. So that's why I'm saying it looks like I'm talking to an age mate because of how mature and thoughtful that was. Very, very good. And well done, guys. Everything was straight to the point, and the slides were not too busy. Everything was just amazing. Really well done. Thank you.
All right. And Nancy, would you like to go next?
Sure. Congratulations, everyone. I know there's some sense of relief for having worked so hard on this and getting it ready to go. I will say this was one of the most professional presentations that we've seen today. And I think that's reflected in what Dr. Aisha said about she felt like we were hearing from mature adults. I like the way you were very conversational in your presentation. And I think what that speaks to is that you knew the material and you were confident and to share it with us. And so I just can't say enough about how great your presentation skills were, all of you. So you should be very proud for that. Your slides were extremely well done and very professional. I think when you talked about the community workshop, I think that was a great idea that you talked about. You would cover 3 topics, because if you want to share everything and you want to impart all the knowledge that you have, but you must realize that they can't remember it all. So the fact that you were going to address 3 topics, I just think that was good insight on your part about your audience and who that would be for. So congratulations, you did a great job. I can't think of anything that you really need to improve upon. You were just wonderful. So good job.
All right, and Umar.
Well, it's always good to hear a good comment from judges, especially when you have an amazing presentation. So I totally agree with Nancy and Dr. Aisha. They all say the right words. So, and let me be honest with you, like this is really a huge situation, like all over Nigeria, not just Bauchi in particular. When we're talking about malnutrition, we're talking about anemia in children. You guys have mention a very, very important topic, despite the fact that UNICEF is there, WHO are there, campaigning about how breastfeeding is really important. But if you look at the main issues, you may realize that, okay, why is it not making so much impact? Is it that because you don't deal with the people directly, or you don't educate them properly, and you don't provide like a supplement if this one is not working? So for instance, for a poor lady who finds it difficult to eat and who cannot be able to have enough breast milk for the child, so what do we do instead? So in your presentation, you guys amazingly mentioned a supplement, substitute to that. If you don't have this, you can actually relate to this. So, and that is one of the best thing that can happen to any presentation, because it's more or less like you're giving me an option. If I don't have this, I can actually rely on this. So and educating the locals to show them like the importance of taking care of the child, and when we're talking about malnourishment, Dr. Aisha, she knows this doesn't stop only on the kids, but adults also experience this situation. So but your presentation has covered both. So, and I think whenever the audience listening to your presentation, especially your community workshop, and I totally agree with Nancy, you cover only 3 topics, something very, very important. You didn't make it too much for people to take home. So you make it very, very, you're very, very specific on some topic that will be enough for people to take home and to learn about how to take care of their kids, how to take care of themselves. So it's really, really engaging. Like, you guys are really, really, professionals on this, and I can see how you were able to shift the responsibility from one person to another, and you were able to explain it very, very clear. Like, there is no question about it. There is no criticism in terms of your slide, in terms of the graphics. You guys are very, very well prepared, and I'm really, really proud of your team. And congratulations for making this night an amazing night for us. Thank you.